Hello everybody, my name is Jack Ryan, and I'm the National Services Director for Acology Incorporated. Thanks for joining us in our second webinar. The last time we spoke, I introduced you to the Medtainer. In this webinar, we're going to talk about the Medtainer and experiences that nurses and healthcare professionals have had in the field. But first, I want to reintroduce you to a friend of ours who you met last time. This is Jane. Jane is 85 years old and suffers from progressive Alzheimer's disease. And this is Jovi, her caregiver. Jovi is using a Medtainer to grind Jane's medications. He mixes the medication either with water or an Ensure. Puts them in a syringe and then administers the medications to Jane.
Feeling okay.
Atta girl. Are you feeling okay?
Yeah.
Atta girl.
This is Jane a year later. As you can see, she's non-responsive. However, she's still getting medications by syringe after having been ground in a Medtainer. Jane is pain-free. She has no anxiety. And she's comfortable. Once again, let me introduce you to the Medtainer. The Medtainer is made from number 5 FDA-approved polypropylene. It's waterproof, smell-proof, certified child-resistant, and every Medtainer has a grinder. Now the grinder works with pills of all different kinds of sizes and all different kinds of densities. I'm going to show you a demonstration on how the Medtainer works in just a moment, but let me tell you one of the first things that nurses and healthcare professionals have a concern about when they talk about the Medtainer. A brand new Medtainer is stiff. When you open it, you hear that little click? It gets easier to open the more you do this. So when you're first taking a Medtainer out of the box or using a brand new Medtainer for a patient, make certain that you just do this a few times. That loosens up the cap, and it'll be much more easy to open up a Medtainer once you just start loosening it up a little bit, okay? Learn how to play with it. The Medtainer, remember, is going to be a really good addition to your patient's healthcare regimen. So now I'm going to do a product demo. Now, we open up the Medtainer, and what I'm going to do is I'm going to use aspirin in this particular case. That one wasn't very easy to open either, okay? So, here is a medication bottle that is full of your patient's medication. No cross-contamination. Medtainer is dedicated to one specific patient. It is a one-patient solution. So now, if we take these aspirin, it's about 400 aspirin there, okay, and put them in the container. Now all we're going to be doing is for about 15 seconds, we're just going to grind these components, and then you're going to see something remarkable. You can feel that it's really easy to do, and as you're grinding this, it becomes less and less resistant. That means that the medication is grinding brilliantly. About 15 seconds later, you've got powder. I'm going to pour this on the table so you can see the consistency. Now I want to show you the consistency here, okay? And this is easily put in an Ensure or water or a G-tube or whatever modality your patient needs in order to take their medication. Applesauce, pudding, ice cream. Sometimes the best thing with medicating a patient is to fool them into thinking they're making a really great decision on what they're going to eat. Sometimes you just have to put it in a syringe, like you saw it with Jane, and give them their medication. Remember, medication control, one of the first of the 4 pillars of a really good care plan. So let's talk about some of the problems that nurses have had in the field. With the Medtainer, you're going to have to replace this probably every 90 days or so. It's not because the Medtainer breaks or the grinding component teeth break off. It's because the teeth wear down a little bit and it becomes a little more difficult to grind your medication. We do have Medtainers that have been in the field in continual use for more than 6 months. This is a very durable, very rugged product. One of the reasons why we chose number 5 polypropylene is because it is so rugged and it is so durable. So about every 90 days, just to be on the safe side and to make it easier for you, make certain you replace your Medtainer. The second thing is, and remember now, we did this in about 20 seconds or so. So we're grinding component here. I've already got some medication here. This is the medication that I poured in here. Aspirin is hard and it's dusty. Now watch what happens when I just take the Medtainer box off. Look at that. You know, puff of smoke and a hearty hi-ho silver, okay? Nobody wants to breathe that. But let me show you something that's really important about the Medtainer. I'm going to use a clean one. Now watch. When I open this up, you're going to see there's a little suction thing here, okay? And there's this little band right around the edge, right here. See that band? That band is one of the reasons why the Medtainer is waterproof. Not just because of the cap, but because of the way the bottle is engineered. So once you're grinding your medication, if you take the medication bottle and you just open it up just past that band. Let me show you a little bit better shot of that band here. See that band? This one right here. It's coming right around the edge here. Just break that like this. You can actually feel it give way, and then tap it a couple of times, and then you're all set to pour. Let me show you in real time how that works. Remember now, this is the one where we had the cloud of dust and a hearty hi-ho silver. We're going to just break. See? And no clouds. Now, the Medtainer is machine washable. You can put it in an autoclave. You can wash it underneath the sink. You can use soap and water on it. All you've got to do is dry it out and your Medtainer is as good as new. Before we continue, I would like to introduce you to some very important people. This is the Acology Advisory Board.
Hi, I'm Josh Luke, founder of the National Readmission Prevention Collaborative and the National Bundled Payment Collaborative. In my 15 years as a healthcare administrator, almost 10 as a hospital CEO, a few more as a nursing home and assisted living administrator, and then as a vice president over a health system where I oversaw hospice and home health, I'm always out there looking for new products and innovations that are going to help move us towards the triple aim of healthcare, which is improved health and care at a lower cost. I recently discovered and started to study this product called the Medtainer. The Medtainer is a very simple approach, personalized medicine approach, if you will, to pill crushing, particularly for those at end of life in palliative care and hospice. And if you look at the Medtainer, as you can see, you can brand it with your organization right here. You take the cap off, you have pills stored in one side of it, and then you pour the pills into the other. Once they're in here, you see these blades on the bottom, you stick it in there and you twist it. You twist it until everything's crushed, and when you're done, you take these pills and you just pour the powder out and you administer the medication. What I like most about this Medtainer, and the reason that I joined the advisory board of Acology Inc., is because it's a personalized approach to crushed pill distribution, which I hadn't seen anywhere else. And quite frankly, as I rounded in the hospital and in the nursing home each day, as I saw my nurses using a rock to crush pills, the same rock they crush the pills with for the person in the room next door, or a machine that's crushing pills, whether in a bag or in any other manner, I saw several opportunities for cross-contamination. And when I came across this personalized medicine approach to pill crushing, I researched it and discovered that this is something that I really believe that can move the needle in healthcare, particularly in end-of-life care. I'd love for you to check it out. You can find it at acologyinc.com. That's ACOLOGYINC.com. As we mentioned, you can brand your organization here. I have several organizations I've introduced this to that have ordered several thousand containers and distributed them to their patients because they see that personalized medicine is the wave of the future. I know I personally, for the person I care for, have a handful of these, one in my car, one at their house, and one at my house, just in case I need them and I don't have it with me. So acologyinc.com, check out the Medtainer. I think you'll find it to be a valuable personalized medicine approach to patient-centered care. Thank you very much.
Hi, I'm Dr. Vincent Nguyen, and I'm a geriatrician, a palliative medicine physician in Newport Beach, specializing in comprehensive medical care for people with serious illness. In over 20 years of practicing medicine, I have cared for people in a variety of settings, in hospitals, in clinics, boarding cares, assisted living, nursing homes, and including people's homes. What I find that the greatest need that I see is medication compliance when people leave the hospital. Medications don't work well if patients don't take them. So adherence to treatment is so critical. However, some medications are just too darn big, and sometimes there's just too many pills to take. This is a major problem, especially in patients who have swallowing impairment. These are patients who suffer from neurological compromise, such as dementia, strokes, Parkinson's, to those with treatment-induced swallowing disorder, such as side effects from chemotherapy or radiation. Preventing patients from unnecessary health complications and hospitalizations are key in my book. When introduced to the Medtainer about a year ago, I quickly realized that the Medtainer can make a patient's and a caregiver's life a lot better. The ease of pill grinding and administration is convenient and safe. This will lead to better compliance, better healthcare outcomes, and better patient and caregiver satisfaction. I appreciate your time and thank you for listening.
My name is Michael Demeretz, and I am a licensed clinical social worker, so I'm a social worker by training. I'm also a certified case manager. I have been doing this work for a very long period of time, 35 years, and I work primarily with the seriously ill. I am the administrator for 247 Care at Home's supportive care program. One of the things that I wanted to express to you is a device that I have come across called the Medtainer. It is produced by a company called Acology Incorporated, and it is a device that actually allows for pills to be crushed to a powder form that will allow us to make sure that a person who has challenges in getting the medication into their body weigh in. Another population of individuals are people who have a difficult time swallowing, people who may have challenges in getting anything down the normal route. Some of these folks may have a feeding tube placed. Some of them may not be at that point yet, but still have a real challenge in getting the medicines in. And so crushing the medications, putting it into food or into tube feeding is going to allow the medicine to get into that person's body as efficiently as possible. It's important for you to think of the Medtainer as a single patient device that is perfectly useful in the home environment. Something that would be assigned to that person, for that specific person, so that you don't have cross-contamination with different types of medications. It's easier to manage, and it's a relatively inexpensive device. Again, my name is Michael Demeretz, and I am very proud to be an advisory board member for Acology Incorporated. Please check out their website at acologyinc.com. Thank you very much for your time.
So, just to review, number one problem that's complained about by nurses is difficult to open. Brand new Medtainer is a little stiff. Just work it a couple of times, like so, and you're going to see that it's easier and easier to loosen up the cap without losing the child resistance. And that's very important. Now, if you want to order a Medtainer without a child resistant cap, that's going to be possible as well. All you have to do is designate that in your order. Just remember, the more you use it, the easier it is to open. Press down, quarter turn to the left, and you're good to go. The second thing is branding. You can brand your Medtainer with whatever organization, hospice care facility, family home care facility, elder care facility, etc. that you may have. Remember, if your logo and your number and your contact information are always in the patient's or the caregiver's hands, it's much easier for you to get a call and to get a referral from that patient or other patients. Remember, your patient always needs you. That's why it's really good to have your name and your contact information put on your Medtainer. The other thing we talked about is the cloud of dust and the Hardy Hi-Ho Silver. Remember, all you've got to do is loosen up the Medtainer. You've got to just make certain that it goes past that little middle band there, tap it a couple of times, and look, there is absolutely no problem with dust. Also, you want to wash your Medtainer out once the medication is gone. Remember, once the medication is gone, it can be used again. So long as you clean it, you can put it in a dishwasher, you can put it underneath the tap, you can put it in an autoclave. Number 5 polypropylene is extremely durable, and you're not going to see a lot of degradation or wear on the Medtainer. It's a great little product. We would like to thank some of the organizations and professionals who have used the Medtainer in the field over the course of the past year and have given us their excellent feedback. Great organizations like Silverado and Gentiva and Saddleback, some of the smaller hospice and care organizations. Our board of advisors has been terrific in guiding us through this introductory phase for the Medtainer. We also want to tell you that we've discovered that the Medtainer is the perfect, and I don't use that term too loosely, it is the perfect solution for home care providers. If you have a patient who is in home, or if you have a patient who's being discharged to home, and they are having any problems taking medication, remember, if you're dealing, for example, with Alzheimer's disease, 100% of those patients are eventually going to become dysphagic. They all have difficulty swallowing medications. If for any reason you have a patient that has difficulty or you anticipate is going to have difficulty swallowing medications, then you need to order the Medtainer. We're going to show you a brief graphic now. You can order the Medtainer from us directly or through your professional organization. Our website is acologyinc.com. You can meet our advisory board on the website. As a matter of fact, they have some really wonderful statements and personal experiences with the Medtainer. We've also got a couple of our webinars up there. You're going to see this webinar, and you're going to meet Jane, and you'll find out a little bit more about Jane and who Jane is and what her past was. Jane is a terrific individual. And at that particular point in time, ladies and gentlemen, we'd love to have you call us. If you're using the Medtainer already, please give us a call, drop us an email, let us know how we can improve. And if you need the Medtainer for your clients or your patients, please give us a call. Once again, on behalf of all of us here at Acology Incorporated, my name is Jack Ryan. I want to thank you for your very valuable time, and I hope you have a spectacular day.